Hello delegates, my name is Derik Sven, President-elect of Virginia's chapter and first alternate for its delegation. I'm honored to bring forward a resolution that I believe will speak to the integrity and credibility of our profession. I am proposing that the American Dental Hygienists Association adopt the following policy. ADHA supports residency requirements for licensed oral health practitioners prior to engaging in autonomous practice. Let me tell you why this matters. Right now in general dentistry, it is common for practitioners to perform complex procedures like surgical extractions, root canals, and implant placements without ever completing a formal residency or logging supervised clinical hours post-graduation. There are many instances of dental graduates never having placed an implant, and yet they have the legal authority to attempt an all-on-4 procedure in most states, should they have the temerity to do so. This is a glaring departure from medicine, nursing, and veterinary care, where structured residencies are the gold standard before independent practice is allowed. Physicians, surgeons, nurse practitioners, physician's assistants, even veterinarians all complete supervised residencies before taking full responsibility for patient care. Dentistry is the outlier. As dental hygienists push forward in our pursuit of autonomy, we must do so with credibility. That means holding ourselves to the same standards of safety, competence, and public trust that other healthcare professions already meet. This isn't about gatekeeping, it's about leadership. Requiring a minimum residency before entering autonomous practice demonstrates our profession's deep commitment to patient safety, evidence-based care, clinical readiness, and interprofessional respect. It sets us apart not just as advocates for expanded roles, but as advocates for clinical integrity and for public accountability. I also ask this House to look beyond the face value of this resolution and consider its broader implications. Organized dentistry's long-standing rejection of dental hygiene autonomy rests on the premise that dentists, by virtue of their education, are the default, all-encompassing oral health providers. That argument collapses under scrutiny when we recognize that most dentists enter practice without any supervised postdoctoral training, or even performed a procedure they are legally allowed a single time. By championing residencies for all oral health providers, hygienists can shed light on the structural deficits in dentist education and on the real dangers this poses to public safety. Consider how many dentists, some of whom you know personally, perform complex surgical procedures after informal weekend trainings, sometimes held abroad under inconsistent standards in countries with limited regulatory oversight. How many of you have seen the disastrous consequences of these weekend warriors? The public deserves better, and so does our profession. This as we witness organized dentistry rapidly attempting to dismantle the hygiene profession as we know it. Importantly, the language in this resolution was crafted with precision. It is intentionally complementary to both existing ADHA policy and the forward-thinking proposals being introduced in this session. It does not disrupt the progress made in states that have achieved full autonomy without formal residencies, but supports a structured, sustainable model of autonomous practice that emphasizes safety, training, and credibility on par with our medical counterparts. This resolution will strengthen our national policies while respecting the diversity of state-level progress. Let's be clear. This resolution does not limit autonomy, it strengthens it. It provides a structured, responsible path forward, one that says to the broader dental community, dental hygienists aren't just asking for a seat at the table. We're bringing our own, and we've done the work to earn it. By adopting this policy, ADHA will lead from the front, championing reform that is not just bold, but sound. Thank you for considering.